Good morning, I'm Diane Macedo. Thanks for streaming with us. In today's update, Republican lawmakers have overwhelmingly voted to elect Congresswoman Elise Stefanik to House leadership, replacing Congresswoman Liz Cheney. Stefanik beat Congressman Chip Roy by a wide margin of 134 to 46. After the vote, Stefanik said her focus is now on unifying Republicans and fighting Democratic policies. She also reiterated her support for former President Trump.
I believe that voters determine the leader of the Republican Party, and President Trump is the leader that they look to. I support President Trump. Voters support President Trump. He is an important voice in our Republican Party, and we look forward to working with him.
Stefanik is an outspoken Trump supporter and had his support for this post. Trump weighed in after the vote, saying congratulations to Stefanik for her, quote, overwhelming victory. Plus, rows of gas tanker trucks are finally fueling up now that Colonial Pipeline is back up and running. The price of gas is also finally falling in several states in the Southeast, but it could take weeks for things to return to normal. Plus, ABC News is learning hackers were paid a ransom of a few $1 million to finally get pipeline operations restarted. And the CDC says vaccinated Americans can now ditch their mask in most locations, both indoors and out. President Biden even took his own mask off to discuss the news.
It's a great milestone, a great day. If you've been fully vaccinated, you no longer need to wear a mask.
So are we approaching...
If you are fully vaccinated, you no longer need to wear a mask.
So are we approaching a return to normalcy here, the beginning of the end, if you will? Right now, more than 118 million people are fully vaccinated. That's more than a third of the U.S. population. Some of the 24 states that still have mask mandates are now looking to lift those restrictions. But some businesses have already said they aren't changing their rules yet. I want to bring in physician at Stanford Children's Health, Dr. Alok Patel, to break this all down for us. Dr. Patel, thanks for being here. What was your reaction to the CDC's new guidance, this announcement yesterday?
Well, I had two reactions, Diane. The first one was really applauding the underlying science and the new data about the effectiveness of vaccines, because we seem to be kind of overstepping the fact that they presented new data showing that the vaccines really do prevent symptomatic and asymptomatic infections. And also, if you're vaccinated, in the rare chance you actually get COVID-19, you're much less likely to spread it to someone else or get severely ill. But regarding the new lifting of the mask mandate and saying that vaccinated individuals can now take their masks off, hug each other, go party indoors, that seems like the CDC went from 0 to 60, in my opinion. It seems a little rushed.
And now a big question coming out of this new guidance is, will there be some kind of vaccine enforcement? Right? If you're a business, how are you supposed to handle this when there's no way to tell by looking at someone whether or not they're vaccinated?
That is a great question you pose, and it's a question that a lot of us have, and it really highlights the fact that now the onus is going to be placed on local and state leaders and all those businesses out there. As you just mentioned, 24 states still have mask mandates, and you can look at headlines right now. There's several states who have said, let's go ahead and follow the CDC's guidance, but then there's other states, Hawaii, California, New Jersey, who have said we're going to keep mask mandates in place right now. And, I feel for the individuals out there who are immunocompromised, who are under the age of 12, or people who haven't been able to get vaccinated yet, and what this means about their health. Because guess what? The honor system and saying that you're vaccinated and you no longer have to wear a mask, that's not really enforceable, and I'm not sure how much a lot of people trust that. And you know that a vaccine passport probably isn't going to work in most parts of the country.
Now, the New York Yankees are also reporting an outbreak now. At least 8 fully vaccinated members, they got the J&J vaccine. They still tested positive for COVID-19. Now, their infections are mild or asymptomatic. So is this the way forward now, where we will still see outbreaks, but they'll be mostly mild or asymptomatic?
It's possible. And I want to make sure that people really understand what you just mentioned right there, is that you can still get the infection if you're vaccinated. It's not nearly as common, but you're much less likely to get severely sick. So people shouldn't be overly surprised if they see breakthrough infections. Remember, these vaccines from Johnson & Johnson, Pfizer, Moderna are all above 70 to 80% effective. That's important. And, part of me also wonders if maybe the CDC should have presented this data about the effectiveness of the vaccines and then said, hey, if we reach a certain number, let's go ahead and lift those mandates maybe in a few weeks or in June, for example.
And a lot of people have been posing this question anecdotally of could they have tested positive from the vaccine, not from the virus itself? Is that even possible?
It's not. And so I will debunk two things right now. You're not going to test positive from actually getting the vaccine, because what your body is doing is making a blueprint for the vaccine, not actually making the virus itself. And also, just since we're debunking things right now, Diane, there is no such thing as shedding the virus from the actual vaccine itself. As we're pushing more Americans to get vaccinated, we still need to make sure we're debunking the misinformation that seems to be spreading every single day.
I love the myth busting. I love it. I do have a question, though, right? I have a 2-year-old at home. A lot of people have youngins at home. I'm vaccinated, but he isn't. So I don't want to risk getting him sick. So how do parents like me handle this if we can still get sick? Is my low risk plus his low risk for being young enough, or do the rules not apply to me?
It should be enough. Now, remember, first of all, I applaud you for actually doing the responsible thing and looking out for your little one. I have a newborn baby girl. I'm thinking about the same stuff right now. Mm-hmm. Now, if you're vaccinated,
Congrats,
you're much less likely. Thank you. That's why I'm sleep deprived. I don't know if you can tell. But that's also why you're much less likely to spread the virus in the rare chance you do get it. But again, I'm hearing from a lot of parents out there who are saying, hey, my elementary age child, my baby is not going to be able to get vaccinated for at least several months, if not early next year. How do we stay protected from everyone else out there who may be infected and may not be wearing a mask? And that's a big question. That's where the responsibility really does fall on the individual.
And what about the little questions, right? Like if I were to go into a store up until today, I would take him with me. He has his mask on. Everybody else does too. So I feel comfortable with that. But if I'm going to take him into a store where people aren't masked, that makes me a little uneasy.
And I don't blame you for feeling that. And what I would tell parents out there, or someone who may not be vaccinated, if you're with someone who's immunocompromised, whatever it may be, is to think about community transmission in your area. Think about the actual business you're going to. Is it a kind of a spread out indoor, farmer's market or something? Or is it a really, crowded bar or restaurant? And you might want to take that into consideration about where you're going right now. And again, like we keep talking about, I think this is going to vary from state to state. In New York versus San Francisco versus Alabama versus Louisiana, there's different vaccination rates. And that's what I'm seeing certain businesses, local and state leaders paying attention to when they're deciding whether or not to lift these mask mandates. So everyone's got to do what they can to protect themselves. But I think, again, the important thing to pay attention to is that the vaccines absolutely work. And these guidelines really do work themselves, assuming that everybody is vaccinated. So that seems to be the gap. But Americans out there should just realize that there is a reason why cases are going down right now, especially in places where vaccination rates are high.
All right, fine. So I won't take my 2-year-old to a crowded bar.
Maybe not yet. I don't know what kind of bar. If it's like a milk bar or something, or some cool pseudo child bar I haven't been to yet, that might be okay.
We might be onto something. We'll invent that together. One more question though, because we know that, and I hate to be the Debbie Downer here, but things are looking good in the U.S. But you look at places like India where that's not the case. We keep hearing about the potential for new, more dangerous variants. How concerned should we be about that in this context?
Well, you are not a Debbie Downer at all. In fact, you're a realistic Regina. I just made that up. But, I think it's important to pay attention to the fact that, yes, things are going very well in the United States. But again, this is a global pandemic. And you can actually see in other countries, such as Brazil and India, what can absolutely happen if you have the combination of a lower vaccination rate plus a new variant. So even though we're lifting mandates and we're celebrating success in the United States, all it takes is a low vaccination rate in this country in some area, plus a variant or the introduction of more virus from other people, and you can absolutely have more outbreaks. We've seen this happen in the past with influenza, with measles, with whooping cough, and we can absolutely see this happen in the future with coronavirus. And so people just need to make sure that they understand what the realistic finish line really does look like. Lifting a mask mandate does not mean that we're out of the pandemic. We're still seeing thousands of Americans getting sick every day, hundreds dying, and we're seeing outbreaks all over the world.
All right, Dr. Patel, great to have you as always. Congrats again on the new baby, and whatever your tips are for hiding your sleep deprivation, we will take them all.
Bright ring lights.
Noted. Thanks, Doc.
Thank you.
And tax day is just 3 days away. And in this unusual pandemic year, there are a lot of new questions about what you owe, what you can deduct, right? We all have them. So what do you need to know in time for Monday? Earlier on GMA, Chief Business Correspondent Rebecca Jarvis shared some last-minute tax tips.
One of the questions on a lot of people's mind is whether or not they can deduct for that at-home, work-from-home workspace that they created for their Zoom calls. Well, reality here is only if you were self-employed in 2020, are you able to deduct for that space? It had to be used regularly and exclusively for your work purposes as a self-employed employee. But here's something to keep in mind. It doesn't have to be a separate room in your home. As long as it was a portion of your home that you regularly and exclusively used for work, you can deduct it, George.
How about a lot of people who lost their jobs collected unemployment insurance? What taxes are due for that income?
Traditionally, you would pay taxes on your unemployment benefits. If you collected unemployment in 2020, you should have received earlier this year a 1099-G form. That is the form that looks at all your benefits at the federal level that you collected in 2020. This year, because of the stimulus package passed earlier this year, you do not have to pay taxes on up to $10,200 worth of those unemployment benefits at the federal level if you make less than $150,000. States have their own rules, so you want to check directly with your state tax office, George.
What if someone still doesn't have a job and they just don't have the cash to pay their taxes right now?
And there will be people in that situation. You want to talk directly to the IRS right now. Go to them. Let them know your situation. They can help you set up a payment plan. The fastest way to get that refund is filing electronically. And if you make less than $72,000 a year, you can do that for free at irs.gov. irs.gov, by the way, has a lot of answers to these questions as well. You do have to file, though, George. Even if you can't pay, file, because that will help you not have to pay penalties in the future, George.
That is the most important first step, just 3 days away. Rebecca Jarvis, thanks very much.
All right, our thanks to George and Rebecca for those tips. When we come back, our new series, Feel Good Friday. Today, it's all about an 11-year-old diagnosed with kidney cancer who is now on the road to recovery thanks to a teacher at his school. They're going to join us live after the break. Welcome back, and on this Friday, we are kicking off a new series this morning called Feel Good Friday. We'll be bringing you a little good news heading into the weekend, and today it is all about 11-year-old Gavin Sexton. When Gavin was just 3 years old, he was diagnosed with a form of kidney cancer, but after having one kidney removed, the tumor kept coming back. Radiation treatments damaged his other kidney, so Gavin's parents set out to find a donor for him, sending around an email asking anyone who was possibly interested to get tested to see if they were a match for Gavin. That's when Ann Comino, a teacher at Gavin's school, comes in. She didn't know Gavin, but she did respond to that email, and after a delay due to the pandemic, Gavin finally got some good news.
Can you read it out loud to us?
To us, sweet Gavin, the wait is finally over. On February 22nd, you will be getting a new kid. We love you so much, Mom and Dad. And a cookie. I mean, a cupcake.
What do you think? I don't know. Open it up.
Oh, gee. Man, Australia.
What's the date?
February 22nd, 2021.
Yay!
Gavin's surgery finally happened this past February, giving Gavin a new kidney, and I'm so happy to have both Gavin and Ann, a.k.a. Miss Comino, joining us this morning. Gavin, Miss Comino, thank you so much for being here today.
Thanks for having us.
So, Gavin, my first question is for you. We saw your reaction there to finding out that you were getting a new kidney. How did you feel when you found out that it was someone from your school?
I was really excited for the opportunity to have a person that isn't from like another city or another country or state even. That it was like right nearby and it was going to be a recent date.
And what went through your head when you saw that note from Gavin's parents? You didn't know this family, so what made you say, I need to do this?
I mean, I have two daughters, and for me, reading the email from the Sextons and knowing that, you know, they needed this for their child. If it were my kids, I would have wanted somebody to come forward and I knew I was the correct blood type. And so that just, you know, it wasn't a no-brainer, but it was easy to go forward with this.
So Gavin, describe for me how you felt physically before you were able to get this surgery, get this new kidney, and how do you feel now compared to that?
I didn't feel well. I'd go to school and then come home, not feel well, and sit around. And now I have a lot more energy, and I can actually do other stuff. Go to school with my friends and do some after-school activities.
We were just looking at some photos of you in the hospital, and you're giving everybody the thumbs up sign. How did you feel in that moment when you knew that you had a new kidney and you were on your way to recovery?
I mean, after a transplant, you don't feel well, but mentally it felt really good.
And what was your reaction when down the line, right, you're keeping track of how he's doing and how progress is being made, and you then hear from Gavin's mom that he doesn't need dialysis anymore?
At that moment, when I heard that he didn't need the dialysis, that was an amazing moment for me. Knowing that he didn't have to go through that every day made me really, really happy that I could be a part of it.
And so, Gavin, what do you want to say to Mrs. Cumino about what she did for you?
Thank you.
You're welcome. It was my pleasure.
Keep it short and sweet. And anything you want to say back to Gavin?
I just want to say that it was an honor, truly, to help you and now be part of your life. It's amazing.
And Gavin, anything you want to say to kids who are in that position, who are struggling right now and maybe losing hope?
Keep your head up.
Gavin, and thank you so much for being here. It really is such a pleasure to talk to you both. Gavin, we're so happy to see you doing well, and Anne, it's amazing what you've done. Thank you for sharing your story with us.
Thank you so much.
Thank you.
It's our pleasure. And that does it for this ABC News Live update. I'm Diane Macedo. Thanks for joining us. And remember, ABC News Live is here for you all day with the latest news, context, and analysis. Stay safe, everybody. Have a great day.
Everyone has their own path, so you should just keep going and never give up, and don't compare yourself to other people.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.